Hi, everyone. My name is Dr. Lauren Weber, and I am a psychologist in our outpatient geriatric clinic. And we are here today to introduce you to our rotation. I am a board certified geropsychologist and received my training in New York. I'm also our assistant training director for our clinical psychology internship program. I'm also having to introduce my colleagues here. I'm going to start with Michelle.
Hi, I'm Dr. Michelle Rattinger, and I am the newest team member to join as a psychologist. My background is in clinical neuropsychology, and I was lucky to complete my internship here at James A. Haley.
And I'm Dr. Philip Haley. I joined the Geriatric Psychiatry Outpatient Clinic here at James A. Haley in 2013 after completing my internship and postdoctoral training at the South Texas VA in San Antonio, Texas. I also previously worked at the VA Rehabilitation Outcomes Research Center in Gainesville, Florida, prior to completing my graduate training. As an overview of our clinic, we provide mental health services for veterans 65 and older, primarily with a focus on issues related to aging, health, and cognition. We do, on some occasions, treat veterans below the age of 65, particularly when their presenting problems are closely aligned with those three areas I just mentioned. The Geriatric Psychiatry Outpatient Clinic has been in existence for some time here at James A. Haley. However, I joined the team as the first psychologist in 2013, and since that time, we've added 2 additional psychologists. We are focused on providing outpatient psychotherapy in our part of the clinic, and we receive consults for those services really throughout the hospital. A primary source of our consults would come from the psychiatrists on our team. However, we also receive a lot of consults from primary care psychology, and we also receive those consults from other medical providers and mental health providers throughout the hospital. When we receive a consult on behalf of a veteran, we triage and evaluate that consult to make sure that the services that we provide are going to be the best match for the veteran. On some occasions, we might forward a consult to other services or other clinics if they would best meet the veteran's needs. But if we keep the consult, we are going to schedule the veteran for a thorough evaluation. And during that evaluation, we're really going to assess the veteran's life as a whole and try to make determinations about what sort of services we can provide to help with their presenting problems. In the way of outpatient psychotherapy in our clinic, we have both individual and group therapies. We offer a number of different individual therapies, such as cognitive behavioral therapy, interpersonal psychotherapy, and other approaches. And we also have a number of groups that we're doing at this time. For instance, we have an Aging Matters group, which is aimed at providing psychoeducation and psychological support for veterans who are dealing with common age-related issues. We have a cognitive behavioral focus group for individuals with anxiety and depression. And we're also developing a problem-solving therapy group, which is aimed at building foundational skills to manage various life stressors.
Great. Thank you, Phil. Now I'm going to talk a little bit about how training works on a day-to-day basis in our clinic. Typically, trainees are on rotation with us for 3 days, and most of that time is spent conducting clinical work. So you do get a lot of direct care hours in our clinic. There are opportunities, as mentioned before, for conducting initial diagnostic evaluations. And this is really our opportunity to put together all the pieces of the puzzle. Often geriatric patients have many problems, including medical, sometimes prescription issues, all sorts of things that can be contributing to their presenting problem. We also then figure out what form of individual psychotherapy would be most appropriate. Conduct sometimes cognitive screening, offer caregiver support, and there's many opportunities to either lead or co-facilitate groups in our clinic. As mentioned before, both myself and my colleagues are trained in IPT. I am a consultant in IPT, so there's opportunities to also get consultation in that practice. but we also offer exposure to cognitive behavioral therapy, problem-solving therapy, ACT, DBT, and various other modalities that we've all been trained in. Michelle, would you like to talk a little bit about some of the other opportunities on our rotation?
Yes. So on this rotation, as alluded to, you would get exposure to different supervisors coming from different backgrounds and holding different philosophies for care. So that would include interpersonal approaches, cognitive behavioral leanings, even psychodynamic training. And on this rotation, you'd have opportunities for several different rotation-specific didactics, like dementia boards, geriatric grand rounds, and the health psychology seminar. And those include topics that span a lot of really wonderful new research, like guardianship, medical decision-making capacity, the newest treatments in Alzheimer's. There's also the opportunity to collaborate across various disciplines that we work closely with, including psychiatry, general medicine, so primary care providers, specialty services, and also social workers. Also, as a note, if you're not selecting us for a rotation this year, we also offer supervision for core psychotherapy cases and also for those comprehensive assessments that you'll be completing this year.
Great, thank you. Last, I'd like to talk a little bit about our model of supervision, which is developmental and competency-based. And what does this really mean is that we meet you where you're at, and we try to develop both breadth and depth in assessment and intervention skills. We have many interns that come to us with a wide variety of clinical skills and interventions that they've been exposed to, and we really try to build off of that for those individuals. There are others that come to us with very limited psychotherapy experience, and we really try to meet them where they're at and help them build those foundational experiences and knowledge so that they can best treat the geriatric population and veterans that they will be working with. This is a very popular rotation amongst our neuropsychology interns as well as our general psychology interns as well. Lastly, we just want to say that we look forward to meeting you during our open house and interview days. Feel free to contact us directly via email, which is listed in the brochure, if you have any specific questions. Thank you.